Hi, I'm Dr. Marc Gittelman from Uromedics and from Optimal Health Miami, and today we'll be discussing the various options for testosterone therapy. Now that we've established that your testosterone levels are suboptimal, let's discuss all the different options for taking what I call testosterone therapy. There are many options for testosterone therapy. There are the topical gels and creams which come from the standard pharmacy. Topical means applied to the skin. We can also compound a bioidentical testosterone either as a cream or injectable, and these come from the compounding pharmacy at a much more reasonable price than from Big Pharma. There also are patches which are applied to the skin. We offer short-term injectables of testosterone. We offer long-term injectables of testosterone. It's important to note that there are no pills. No oral therapy has yet to be approved by the FDA. So let's talk about the pros and the cons of each of these options. Let's start with the topical gels and creams from the pharmacy. These are the ones you hear advertised all the time on TV. But there are lots of issues with the topicals, and I'm not a fan of the topicals for the following reasons. First, they're really sticky and messy. They have to dry totally before you can even put on a shirt. Also, you have to be concerned over what we call transference to your children or significant other, or really anyone that you could come in contact with. And that can really be a problem. I believe using testosterone gels when there are kids in the house at any age really should not even be considered. And if your significant other is pregnant, it's an absolute no-no. Generally, the cost of gels is extremely high. It's as much as $300 a month. Sometimes this is partially covered by insurance, but other times it's not covered. And equally important is that we often have difficulty in reaching the therapeutic levels of testosterone, which is what we really need for an effective treatment for you. We can also make bioidentical compounded testosterone creams or gels through a compounding pharmacy. They are much more affordable than the pharmacy branded options. They typically are less than $100 a month. And they are titratable. That means we can adjust the dosage very easily. We typically use a device called a top-a-click dispenser. The number of clicks dialed determines the volume and therefore the dosing of hormone cream that comes out of the device and that will be applied. They're generally very easy to use. Next, we have the patches. A new patch is applied every day. But they're very obvious, almost a reminder to yourself, to your significant other, or anyone seeing you at the beach or in the gym that you're on testosterone therapy. In addition, there's a fairly high rate of skin reactions, which can be problematic. Patches are also quite expensive. And just like the gels, we often have difficulty in reaching the therapeutic levels that we really want to get to. Without question, the best alternative for therapy is using the injectables. First, there are the short-term injectables. They're easy to self-administer weekly in your thigh or in your buttocks or even in your subcutaneous fat, which is just below the skin in your tummy area. I know right now you might be thinking that it will be challenging to inject yourself, but it's really not difficult and nearly everyone catches on fairly easily. You'll be surprised at how quickly you'll become comfortable with this method. The injectables are excellent for reaching the therapeutic levels we like to achieve. Adjustment of dosing is very, very easy and very accurate. And actually, they're the least expensive. In fact, most of the time, the cost is about $5 a week. The injectables allow testosterone to be dissolved into different oils. Testosterone has been generic for decades, and the generics come in what is called cottonseed oil. It's much harsher on the muscles, and the absorption can be compromised. So we prefer to have patients take testosterone that's made in either sesame or grapeseed oil. Most people find these easier to tolerate. It's a much finer oil. They're still very inexpensive. We're looking at $5 a week. Starting on the short-term weekly injectables is often my first choice for patients to get used to being on their testosterone. And in 4 weeks, I'll be checking your testosterone levels, and we will either adjust your dose or go on to try the long-term injectables. So let's talk about the long-term injectables. These are administered as an injection, but only in the office by me as your doctor. They last 3 to 4 months, and they are very convenient. They usually, but not always, are covered by insurance. Well, let's not get ahead of ourselves now. First, we will teach you today how to inject yourself in either your thigh, your buttocks, which is your bottom, or if that seems unimaginable, we can teach you to inject subcutaneously in that little fat layer just below the skin in the belly. But by the time you leave today, you'll know exactly how to inject yourself.